Hempstead town officials are set to announce new legislation that would prohibit the sale of flavored vaping e-liquids. Lawmakers say that the move is in response to what they say is a vaping epidemic among kids in the area. Supporters of the bill are on Long Island right now, getting ready to discuss the measure. Let's go ahead and listen in.
To stamp out this horrible epidemic. And we have Barry Wolansky, who is with the town of Hempstead. He's our mental health and substance abuse coordinator. Supervisor, would you like to say a few words?
Sure. Good morning, everybody. I am so delighted to be standing here today with Councilwoman Erin King-Sweeney, who has joined me and who has advocated for this legislation, and with our county executive and our county legislators who are joining us also in really what is a call to arms. Today was the first day of school for many of us. Took my children to 4 different schools this morning, so it was a little bit hectic for me. But as we go off to school, you think of happiness, you think of seeing your friends, education, but unfortunately a real persistent reality now in our middle schools and in our high schools is the use of e-cigarettes and vaping. It's something that we as parents have to battle every day to really convince our children this is not okay. This is not safe. We've come so far when we see our children think cigarette smoking is disgusting. Why would anybody do that? It kills you. But yet they're taking Juuls and they're vaping, and we have no idea what is in those cartons, the chemicals that are in there. We've seen a host of really scary stories published in the press these days about young people having their lungs collapse. We don't collapse. We don't know what's in these cigarettes. 3.6 million teenagers, high school students and middle school students are using e-cigarettes. This is something that we need to address, that we need to stop, that we need to curb, and we think that this legislation is a step forward in that direction. Banning the use of flavors to make it seem like it's fun, like you're having some bubble gum when you're vaping, is what gets our children hooked on these devices at a very young age. So I thank PAVE for supporting us. They came and spoke to us when we were dealing with the use of recreational marijuana, and they're here again today to support us in this legislation. And so I urge my county colleagues in government and even our state colleagues in government to move this ball forward and to really do everything that we can to stop the use of e-cigarettes and vaping for our children. Thank you. Thank you, Councilwoman.
Thank you, Supervisor. I think it's important to note what the town has done so far. Supervisor Gillen and all of my colleagues on the town board unanimously in April of 18, we unveiled signs at all the town of Hempstead parks banning vaping in town parks, town facilities. In September of 18, the board unanimously passed legislation that requires businesses that sell these products to post large signage that would alert consumers that these products contain dangerous chemicals. And in June of 19, the town board unanimously passed legislation that regulates the advertisement of these products near schools, 1,000 feet within schools, parks, playgrounds, and licensed child care centers. So I'm really proud of what the town of Hempstead has done. I encourage all the towns on Long Island to follow suit, particularly North Hempstead and the town of Oyster Bay. We would welcome their participation in this as well. And I'm honored to have County Executive Laura Curran. I think this shows you that at all levels of government we can work together, whether Republican, Democrat, local level, county level, we're getting it done and we're protecting our kids. So with that, Laura.
Thank you very much. Thank you very much, Erin and Laura, the town councilwoman and the supervisor, for your leadership on this issue. You are moving forward on this very important legislation that would ban flavored vaping in the town of Hempstead. This will be the first, but I know it will not be the last. You are really paving the way, no pun intended, to get this done, to keep our kids safe. On the county level, legislator Drucker, who was with us today, last spring proposed and actually filed legislation to do the same at the county level. And I am hopeful and encouraged by this action, and I'm very optimistic that it will be considered and passed by our legislature as well. You know, I was at the Plain Edge opening of school today in one of their elementary schools, and I was speaking with the superintendent, and he said something that we've all known: smoking cigarettes is no longer considered cool in high school, as it was when I was in high school in the 80s. It was considered quite glamorous, believe it or not. But smoking cigarettes had pretty much been wiped out. Now, with vaping, everybody's doing it. I mean, that's what I'm hearing. It is skyrocketing, even more than cigarette smoking was back in the day. Vaping is happening at the middle school level, at the high school level. The nicotine is in a much higher concentration. And let's not forget, it's not just nicotine that's being ingested by these devices. It's also THC. In high school, in middle school, you can't smell it, you can't detect it. It's dangerous stuff. Our police department recently took down a big operation of bootleg e-cigarettes. So it was, I forgot the brand, but it was a well-known brand, but they were counterfeit. They made Lord knows where, with Lord knows what, and being sold as if they were the real thing. So it's basically taking something that's dangerous and making it even more dangerous. Some really alarming statistics. As of August 27th, there were 215 cases across this country of severe lung damage from vaping, caused by vaping. A lot of that was young people. A lot of them were young people and children. That number, unfortunately, is dramatically rising. Now, why is that? Cigarettes are not being sold as much, so the tobacco marketers are really aggressively marketing directly to children. Just look at the flavors, things like Oreo, cotton candy, banana strawberry, stuff that kids really like and are really, really attracted to. So I really want to thank the town of Hempstead. I want to thank Supervisor Gillen and Councilwoman King-Sweeney for being the pioneers here, for getting this done. We're looking forward to getting it done on the county level thanks to Arnie Drucker's legislation. We got to keep our kids safe. It's up to us. Thank you.
Thanks so much, County Executive. And Debbie Muley, can you please say a few words? County Legislator, thank you.
Good morning, everybody. I'm Deborah Muley. I'm the legislator for the 5th District in Nassau County. I just want to commend the supervisor and the councilwoman for pushing this forward. It's something that absolutely needs to get done. Last night I was watching TV and I saw a very cute commercial, but it really drove a point home. There were all of these lab animals, and they were speaking and, you know, running in their little wheels, and they were protesting using humans as lab rats. And what they were talking about was e-cigarettes, and that is what we're doing. Humans are basically being the lab rats, and unfortunately now we're seeing the results. As the county executive said, that number is horrifying, and we know it's only going to grow, of people who are having severe effects of the use of e-cigarettes. And so whatever we can do to stop this scourge at the town level, at the village level, at the county level, at the state level, at the federal level, this is all hands on deck, and we all have to do our part. And I will certainly be supporting Legislator Drucker's legislation and seeing what else we can do at the county level. Thank you.
Thank you, Debbie. And I should have mentioned you were a fierce advocate for this a couple months ago when you joined us at our press conference when we were limiting the advertising of these near schools. So thank you for that. Arnie, you want to say a few words?
Sure. Thank you very much. Thank you. I'm Arnie Drucker, Nassau County Legislator for Legislative District 16. I also want to thank Councilwoman Erin King-Sweeney because her advocacy, and Supervisor Gillen and all of town of Hempstead for taking an initiative here, because it is an epidemic. I speak to the administration and the faculty of the schools that are in my district, and they consistently tell me that this is out of control. It is an epidemic, that the kids are doing it because of the attraction by these fruit-flavored pods. And the highest level of concentration, one pod is equal to 20 cigarettes in terms of nicotine. And the nicotine is what keeps them addicted to it. It keeps them bringing them back. And that's what we have to fight. And I just commend, you know, in support of Councilwoman King-Sweeney, I've spoken to her about this. Her advocacy, her passion, her determination is something to be admired, but I share it. I've introduced legislation several months ago at the county level, and I'm so optimistic because I think that there really is no one at this day and age who can say that they don't support it. It's not a political issue. That's why we're here today, all of us, all of the stakeholders, all of the advocacy groups. We're all here today. This is not a political issue. Just like Councilwoman King-Sweeney said, it's not Democratic, it's not Republican. It's something that the health and safety and welfare of our children are at stake here, and we have a responsibility. And finally, it's getting the attention that it deserves. The CDC is now investigating, I think, 251 cases of serious respiratory illnesses caused by vaping. And the Surgeon General of the United States has come out and reported that exposure to vaping in adolescents impairs their cognitive ability going forward. And this is something we can correct now. We have to nip it in the bud. I applaud the town of Hempstead. I applaud Councilwoman King-Sweeney for taking this initiative. I think it's going to establish momentum, and I'm hoping that will carry us through at the county level because it's something that is absolutely necessary. So thank you very much.
Thank you, Legislator Drucker. As Arnie said, this is not a political issue. Obviously, you can see there's a lot of experts here. There's a bipartisan group up here. But Juul has made this political. Juul has spent millions and millions of dollars in lobbying funds, giving money, trying to advance their corrupt agenda to try to harm children. And when you have people like Sean Hannity speaking on behalf of Juul, we need to get and we need to act. So I'm really honored to be here today. Juul has made this political, so let's stop Juul. Next up, I would love to introduce Dr. Dave Newburgh. Come on up.
Thank you, Councilwoman. Hello, everybody. My name's Dave Newbern. I'm an emergency physician at NYU Winthrop Hospital. I'm also the medical director for the town of Hempstead, and I help lead the town of Hempstead's public health projects. I've been working with the councilwoman, the supervisor, and all the folks on the town board on a number of public health projects for the town, AEDs, opioid overdose reduction. We're working on accessibility projects. We're working on disaster plans and safety plans. So we want to make sure that we keep everybody in the town healthy, both the people that work here, the people that live here, and our visitors that come down to our beaches. We just wrapped up yesterday our beach patrol with our EMS agencies. So, I've been working with the supervisor and the councilwoman on this, and again, I applaud them with leading the way on this. And the councilwoman had come to me a couple months ago and asked if I could give some literature explaining the dangers of these e-cigarettes and these vaping products. They are extremely, extremely dangerous. I know that everyone has been saying that here. The county executive was talking about bootlegged products. The products themselves that are not bootlegged are just as dangerous, if not more dangerous, than the bootleg ones. And to the point that you made, that you don't know what's in these things, they are not regulated. Okay, so even if you're taking the brand name, you're getting it right out from their manufacturing plant, there's nothing regulated about this. They are chemicals that people should not be getting exposed to. They are superheated oils. That's how they're delivering this to people, because you have to try and get it past the lung. It's a drug delivery, okay? It's a drug delivery device. Think about that. We are selling and marketing a drug delivery device to civilians to have them inhale and directly expose them to nicotine, which is about as addictive, if not more addictive, than heroin and other opioid narcotics. Okay, so it's to the same addiction that we are fighting with the Narcan and our opioid epidemic, but we're putting it in a perfect delivery device, and then we're making it taste good and smell good and taking all of the negative things away that you used to have for cigarettes, where at least some people wouldn't be smoking cigarettes because you would smell bad, or you'd have to hide, or there was a negative connotation in the public that you shouldn't be smoking. These things don't have any of that. That's why, thankfully, we're all here today to warn people. There's no negative connotation until people hear from the experts, and I think you're going to hear from a couple other doctors too. People are coming to emergency rooms with acute lung failures. They're ending up on ventilators. They're having permanent lung damage. Recent studies show that blood vessels in healthy people who have never been exposed to these things get smaller. It causes the blood vessels to get smaller. That could lead to heart attacks. That could lead to strokes. We don't know. Like you were talking about, basically they're using humans as guinea pigs, and we don't know what the long-term effects of these things are, because no one comes to the doctors and says, hey, what do you think about this? They just put this out on the market, and then we're left to take care of the people that get sick from this stuff. So I applaud this from the top to the bottom. We do not want children thinking this is okay. We don't want children thinking that these flavored flavored things are not going to hurt them, and it's a social thing. I just heard about this the other day. You know, they pass around at parties, and they may never intend to get hooked on these things, and then try it once or twice, and because it's so addictive and delivering it in such a efficient manner into their bloodstream that they may get hooked on it without even intending to. So that's why banning this, letting people have the awareness of the dangers of these products is super important, because we want everyone to be healthy. Like I said, this is part of our public health initiatives. It's great we're working with the county, with the town, whatever we're working with, the community. So just it's very important that people get the message. These things are dangerous. They are not safer than cigarettes. They might be more dangerous than cigarettes, but you should not be using these things, and our children certainly should not be. So thank you much, everybody. Appreciate it. And back over. Neubert. I have a card if you need it to. David. Yep. David Newburgh, MD. You got it.
Thanks, Dr. Dave. I appreciate that.
Thank you, guys.
And now I'd love to call up Dorian Furman and Meredith Berkman, who really, I can't thank them enough for their fierce advocacy. We wouldn't be where we are today without them. For them, it's never enough, and I love that. So come on up, ladies.
Thank you. We are so thrilled to be here. As the mom of a teenager who started vaping at 14, not understanding that there was nicotine in these flavored devices, who ended up getting addicted and had a very hard time stopping, I am personally thankful to the entire town of Hempstead and the supervisor and everyone here. Meredith and I started our organization a little over a year ago for several reasons, but we are thrilled that there is so much attention being focused on this right now.
Well, first, thank you very much. We want to thank the fierce advocacy right back at you, as they say, of Town Council member Erin King Sweeney. I mean, she is a force.
A leader,
and we're thrilled to be aligned with her. And we also want to thank Supervisor Gillen and County Executive Curran. Thank you, and all of you. It's really a pleasure. I think just a couple of things. I think everything's been said, but multiple times.
Yeah.
One of the other reasons we started our group a year ago was because our kids came home and told us that at an anti-addiction talk at school, when the adults were out of the room, a Juul representative, unbeknownst to the school and brought in by an outside addiction group naively, came in to tell the kids not to Juul, but followed up every statement by saying, but it's totally safe. And our sons came home and said there was a mixed message in this talk. We did a little investigating, and we realized that Juul had come into the school. At the end of the talk, our sons went up to ask the man, is it bad or good? He took out his Juul, he showed the kids how it worked, and he said, we'll be getting FDA approval any day. Which is ironic when you consider that these products are on the market without pre-market review from the FDA. So these flavors have hooked our kids on enormous amounts of nicotine. The flavors have kept the kids from perceiving harm, even now that there's so much attention. Kids still don't get that they're ingesting not only enormous amounts of nicotine, but known toxins like propylene glycol, benzoic acid, formaldehyde at very high heat, along with degraded nickel from the devices themselves. So it's not a surprise that suddenly there are these terrible cases of acute respiratory lung issues in teens that are possibly linked to vaping, though not conclusive. But it underscores the point. We have no idea what our kids are pulling deep into their lungs. And until more towns follow the example of this town and ban the flavors hooking our kids, we have no way of slowing the enormous rise in numbers of this epidemic.
And the products remain unregulated. There are new products coming on the market every single day. These kids can get them in the local gas station. They can buy them on eBay. The flavors are too many to mention. If more counties and more states don't follow this example, we are going to see the numbers rising. The numbers are already extremely high. They're going to continue rising dramatically.
So this is the most serious adolescent public health crisis our country has faced in decades. And unless we take we take these products, these flavors off the market. As was said, our kids are being used as human guinea pigs for the entire Juul and flavored e-cigarette experiment. So we are incredibly grateful that this town, and hopefully the rest of this county, won't let that happen. So thank you very much.
Thank you.
Thank you, Dorian and Meredith. And it's important to go back to the reason they're doing this. It's all about money. You have Juul has hired high-powered people from both the Bush and the Obama administrations. They're bipartisan, I give them that. But they have spent millions of dollars in federal lobbying funds to try to influence people at the federal level. So whether it's federal, state, or local, we need to do all that we can to stop Juul and to silence people like Sean Hannity who advocate for Juul and influence our children. Next up, if I could please have Lawrence Eisenstein from Nassau County, the Health Commissioner, come speak.
Good morning, and thank you to all of the elected officials. This is a press conference that makes a health commissioner very, very happy. And I must say, I had a lot of points ready to go here, but this has been one of the most thorough press conferences I've ever been at. All of the key points are hit, but I want to bring up a couple of other public health perspectives. First, the billions of dollars and immense work that went into lowering the use of tobacco, which has been extremely successful in Nassau County. Our tobacco use rate is among the lowest in the state and the nation. We've been very successful. To think that a new mechanism has been found to hook young people especially, and all the comments about the flavors, cherry cola, watermelon, vanilla, are absolutely right, that these mechanisms have been used to hook people on nicotine, young people. We're very fearful in the public health community that this will turn around and start to increase the rates of tobacco use ultimately, after so much work and effort has gone into lowering the use of cigarettes in New York and here in Nassau County. From a public health perspective, we also worry about the fact, Dr. Newbern talked about a party where this is passed around, and when you're at the health department, the word flu is on your mind, even in the middle of summer. Think about it. Flu is contagious before people get sick. One person has it brewing, the saliva is on the device, they share it with how many other people at the party, and now we're dealing with an outbreak of an infectious disease. And so there are other public health perspectives besides the tobacco, the nicotine, and the damage to the lungs. But this point was just brought up. I want to reiterate it because I think it was so important. I ran into somebody in my neighborhood this weekend who said, aren't you shocked about these reports that you're seeing about all these children being hurt and teenagers being hurt by their vape products? And I said, well, let's see. They're breathing in immense quantities of an unknown chemical, numerous unknown chemicals that we don't know what they are, what impacts they have, how much is getting into the bloodstream, what direct damage is happening to the lungs, and it's hurting them? No, we're not surprised in the public health community. We're happy, amazed. This is incredible that we have this kind of response, trying to be proactive and doing what we can to limit this before it further expands. And it's already way, way, way too expansive. I meet with all of the school nurses once a year, and the BOCES health people and I have been speaking about how we can strategize to try and limit this. But I think this is a really important step. Public health is very grateful to all of the elected officials here who have done an incredible job bringing light to this. It is illegal, not only for children, but for anybody to use a vape product indoors. Thankful to the governor, T21 bill included this as part of the Clean Indoor Air Act this year. So if you're in a restaurant and you see somebody pull it out in the bathroom and take a swig, that is against the law. Do not hesitate to call the health department or make sure the management knows. So even adults may not use it indoors in a public building. They can use it in their own home. Other than that, the Clean Indoor Air Act is pretty comprehensive. So I want to put that out there. And again, on behalf of all public health, we're very grateful for this event, and we will keep doing everything that we can to try and prevent the spread of disease, try and prevent the spread of use of e-products and cigarettes, and help people who do need the help, that they have resources to get help. So thank you.
Thank you, Larry. And then Dr. Robert Lee, if you could say a few words. Doing a quick come on up. Thank you.
Thank you again. I'd like to thank the leadership of the town of Hempstead in making this move. My name is Robert Lee. I represent New York State American Academy of Pediatrics, which represents over 2,000 pediatricians in Long Island. What's been said, about the statistics is shocking. More than 2.1 million teens have used vaping products in Long Island. More than 10% of kids have reported tried e-cigarette products. And to kind of repeat, with the 215 cases of severe lung infection associated with vaping, it's really not that far. One of the patients was at our own hospital, NYU Winthrop Hospital. This was a teen who was very, very sick, in the ICU, requiring breathing tubes to help him breathe, and his x-rays show some of the worst lungs that we've ever seen. This is not something that's only in other places, it's really here in Nassau County. So we really like to support any measures to advocate to protect kids, to really ban e-cigarettes, to ban the flavoring, ban advertising, and really to protect the kids, because we're fighting against billions of dollars that big tobacco is throwing. They're trying to hook a new generation of customers. And unless we, in the public, really advocate and really try to stop them, this is going to reverse the gains that we've done for the past 10, 15 years. Thank you.
Thank you for your comments and all that NYU Winthrop does to keep us healthy. And now I would like to transition a little bit to the law enforcement side of things. So I know Commissioner Ryder couldn't be here, but if you wouldn't mind coming up and saying a few words and just the impact that you feel this has on law enforcement.
Absolutely.
Thank you.
Well, if I could first just say this, I mean, everyone's talked about, their angles here, and informing people is a good thing, but as far as parents go, they have to bear some responsibility, and what they really need to do is become informed about the signs and symptoms of this kind of use. I can't go into the medical systems. I'm told things like shortness of breath and bloody noses and a variety of things, but they have to find out those things and look for them at home. The other thing is this: all of a sudden you go into your son or daughter's room and you're smelling a lemon scent and you have no lemon air fresheners. You got to be a detective. Hey, something's going on here. All right, and take a look at it. And then the ability to look for these devices, these apparatuses that take all different forms now. They used to look like cigarettes. Then now they look different. Now they look like, things that you might insert into a computer or other things as well. Some of them look like toys. You have to look for these devices. I need a search warrant to go into your home. You don't need a search warrant to go into your child's room and take a look at what they might have. And if they smell this way, if that smell is around them, you might have to do a little digging and find out what they're up to, all right? And again, it's devastating. I'll make a quick personal story. I have a son who's 28 years old. He's an avid spear fisherman. He dives to great depths to spearfish. And somewhere along the line, he started smoking cigarettes. And then he said, well, I can get off of these things. And he bought into the hype that patches would work. They didn't work for him. He went with the e-cigarettes, thinking that would help him decrease the dosages. I said to him one day, with everything I'm learning about it, you're out of your mind. What's your lung capacity going to be? Your breathing. You're not going to be able to do something that you're passionate about anymore. And he stopped almost, I think, immediately, and because he's got a passion for this. He won't be able to dive to great depths, I would imagine, Doc, right, anymore, and do what he loves to do with this kind of behavior. So he's off of it, got off of it real quick, scared the life out of him. But law enforcement's point of view is basically this: it's wrong, it's illegal. We look for people who are selling them, all right? We want to lock those people up, all right? We want to prevent that from happening. Once it's in their possession, there's really not much we can do, all right? But if there's other behavior around and we lock someone up and they have one of these devices with them, we test the contents. We want to know what's in it. Is it just nicotine, or is it an illegal substance as well? As the county executive mentioned before, it could be some liquid form of a drug, right? It could be THC. Anything you can liquefy, you can probably put into one of these devices. All right, so we are looking at it. We started looking at it ages ago. It's become part of our process. We do test. We take a look at it, and quite frankly, it has led to people being arrested for other criminal activity, and it's become part of the case. So thank you. Try to understand what I'm saying is you really do have to become a little bit of a detective, a little bit of a police officer, and watch what your kids are doing and look for those signs and symptoms. And do some investigating on your own. Go online and look for these things. I think it changes every day, right? We're learning more and more about it. And so please encourage that. Thank you very much. Pardon.
Thank you to you and all the men and women in law enforcement for keeping us safe here in Nassau County. And then last up, I'm going to have Jim Berta from Long Island Riptides come and speak about the impact on sports and children. Please identify yourself.
Yeah, hi, I'm Jim Berta with GF Sports. We're headquartered right here in Hempstead. We own live sporting events and entertainment properties, including the New York Open, the only professional men's tennis tournament in the U.S. here at the Coliseum. We also own the Wolfpack Ninjas, traveling ninja events. The most exciting, we're launching the New York Riptide, the men's professional lacrosse team here at the Coliseum in December. Long Island boasts some of the best professional athletes in lacrosse, something to be very proud of. We are honored to support Erin King Sweeney in her goal of protecting youth and families of Hempstead against the dangers of vaping. As a sports enterprise inspiring young athletes and their families, the health and wellness of our community is a core part of our mission, and Erin King Sweeney's quest to limit the access of vaping products and flavors is of the highest priority. We stand ready to educate families at our events, to host health and wellness days, and to enlist our fans and sponsors to get involved. We hope the entire community will support Councilman Sweeney and her leadership on anti-vaping. Thank you.
So Meredith is just whispering to me about a parent toolkit. Want to say it?
Sorry, yeah, I'm sorry. I forgot to say earlier, based on the law enforcement, those excellent comments, I just wanted to say that as part of our Back to School, Not Back to Juul campaign that we've launched, we have a PAVE, Parents Against Vaping E-Cigarettes Parent Toolkit that can be downloaded from our website, which exactly as you said, not only does it contain a lot of the medical information, but it has photos so parents can see what these products look like phone chargers, and it also has 8 signs that you can tell if your kids are vaping, things like a sweet smell or finding plastic pods. So I would encourage everyone to go on our website, parentsagainstVaping.org, and please download the Parent Toolkit so parents can educate themselves. And again, as parents, we're honored to be here, and thank you very much.
Oh, it's my pleasure. And I should note that at 10:30 we do have town board, and that's why the supervisor left. So I know we're a little bit tight on time. I know we had a lot of speakers, but I think everyone was incredibly valuable. I appreciate everything that you said. I'm happy to take questions with the caveat that we have town board coming up in a few minutes.
Just one quick question.
Sure.
Do you know why this is stalled at the county level?
So I'm jumping out of that one.
Well, it's called mathematics. That, you know, really, as we said it earlier, this is not a political issue. But sometimes at the outset, things do get categorized as political. I introduced it. Legislative Relay supported it with me. The county exec supports it with me, but we are in the minority in the county legislature. But we are confident that with the advent, with the proliferation of information, evidence-based facts that we are getting now that shows the damage that is being caused, you can't bury your head in the sand. It's not a political issue. And we are very confident with the initiative taken by Erin King Sweeney and the town of Hempstead that it's going to carry momentum to the county legislature's position, and I think we're going to get it done.
Yeah, I think, John.
We're just listening to Long Island lawmakers who have introduced a new bill aimed at combating teen e-cigarette use. We will have more on this story and the efforts there on CBSNewYork.com.